Marissa Wojcik, here and now on PBS Wisconsin. An unusual rise in non-COVID respiratory viruses is worrying health officials at the Wisconsin level and the national level. Joining us to explain what is happening is Tom Hopt, a respiratory disease epidemiologist from the Wisconsin Department of Health Services. Tom, thank you so much for joining us.
And thank you for the invitation to go on your show, Marissa. I really appreciate helping us get the message out.
Now, you refer to these non-COVID related seasonal respiratory viruses as RSVs. There's also a rise in parainfluenza cases. When do we typically see a rise in these cases, and why are they rising right now?
Well, RSV, or respiratory syncytial virus, commonly known as RSV, is a winter virus. It usually follows the influenza season by about a month or so. So we should be out of the RSV season by now, but we saw nothing during the winter time, as was the case with influenza. We did not see any RSV. And for some reason, it's starting to reappear right now. The reason for it behind it, we just don't know for sure. There's theories that, it's been 18, 19 months since we've had RSV. Maybe it's just time that it reappeared. We just really are kind of shocked that it did reappear. Parainfluenza, on the other hand, usually is a late spring, early summer season. So that's pretty typical. But another virus that we're seeing is seasonal coronavirus, the non-COVID coronaviruses. And again, they're winter viruses as well. And we should not be seeing them at this particular time. It remains to be seen why this is happening. I mean, we've talked about it on a national level. Nobody has a real answer for it at this point.
Now, why does the rise in these viruses have health officials like yourself concerned?
Well, one thing we're concerned about is that people might become complacent. Now that COVID is at very, very low numbers, we are very concerned that people may think that they have respiratory symptoms, maybe a cough or then sneezing, and then it's just allergies. They think they're not infectious. But if these viruses actually got introduced into a setting like a long-term care facility or a daycare, it could be devastating. I mean, it could spread like wildfire, and it could cause severe illness in the elderly population and young children. Unfortunately, we have seen some very severe cases, both in Wisconsin and nationwide, from these viruses.
Now, does the Department of Health Services track how many people are catching these non-COVID respiratory viruses? How do we know that there's an uptick right now?
Well, we have several different surveillance methods. One is our laboratory surveillance, where we have about 100 labs that report voluntarily to the State Laboratory of Hygiene of what they're seeing, how many tests they're running, how many are positive. So that's our positivity rate. And again, parainfluenza, we're at 10, 11%, and we shouldn't be that high at this particular time. RSV is starting to rise a little bit. Coronavirus is about 6%. We're at higher numbers than what we normally see. We also have what we call syndromic surveillance through emergency departments throughout the state, which will give us influenza-like illness. And that's kind of a misleading number. Influenza-like illness is just cough and a sore throat is basically what it is. But that's also done through about 35, 36 different emergency departments. And we're really seeing that starting to rise a little bit, especially amongst the young children. The 0 to 4 age group is really getting hit very, very hard. Those are our two main ways that we are looking at this. So we really don't know the exact number of people who have it, but it's our surveillance systems are both indicating the same thing, that there is definitely a rise in non-COVID viruses.
And you mentioned the rise in children age 0 to 4. And there are hospitalizations on the rise that are not typical for this time of year. What are those numbers at?
The numbers, it's hard to say because these are not reportable per se, but we have been in touch with a lot of the hospitals that have pediatric units, and they are all telling us that they're seeing higher than normal numbers from viruses other than COVID, including RSV, including parainfluenza. And unfortunately, some of these children are so sick that they have to be admitted into the intensive care unit.
Now, people are becoming more concerned about the more contagious Delta variant of COVID-19 that's spreading, and children under the age of 12 are still unable to get vaccinated against COVID-19. Is it difficult to decipher the symptoms of these other respiratory viruses from COVID-19 and its variants?
You make a really good point, Marissa. It is very difficult. The only way to know what virus you are carrying and perhaps spreading is through testing, because the symptoms are extremely similar. So we really can't distinguish between any of them, COVID, influenza, any of these particular viruses, other than doing some testing.
So DHS has reported concerns of elderly and those with underlying health conditions are at more risk for severe illness from these viruses. But why in particular are children becoming seriously ill and, as we already talked about, being hospitalized?
Well, children don't have the natural immunity. And again, there's no vaccines for any of these viruses other than influenza, COVID. None of them have vaccines. So they actually have just a natural lower immunity to these viruses. It's especially important for young children who have any kind of lung problems or cardiac problems, premature children. They're very susceptible to very severe illness from these particular viruses, especially RSV and parainfluenza. Any age group can come down with these viruses, but the younger population, the older population, and people with underlying illness are the ones who are going to get hit the hardest and could run into some very severe illnesses, including pneumonia. Knock on wood, we have not had known of any deaths yet. We have heard from other states that there have been some deaths, but we're continuing to monitor that very closely as well, hoping for the best.
You just mentioned this is happening in other states. And as more pandemic restrictions are lifted, is that giving these other viruses their opportunity to spread after we didn't really see a cold and flu season last winter?
Absolutely. With the restrictions being lifted, it does give that opportunity for these viruses to spread. And we're asking people, again, if they come down with any kind of illnesses, to please use the same precautions that you have been using for the last 18 months. Stay at home if you can if you can help it. If you have to go out, get your mask back out, put it on, and you be respectful to others. Don't spread it to others. Good hygiene, coughing into your sleeve, as I just did, unfortunately. So, and sneezing just into a tissue, and wash your hands. It's simple stuff, but it's something that we have to continue on 365 days a year. But your point is very well taken that these restrictions could actually lead to increased virus spreading.
Are we able to look into any sort of crystal ball and foresee that this cold season is going to be happening year round, or that these viruses are going to gain any sort of strength?
Well, every time we looked into a crystal ball, we found that we're being wrong. It's just, again, comes as kind of a surprise to us, but again, this is why we have to continue as a state health departments, local health departments, to monitor these viruses and the activity 365 days a year. So I don't know what to expect in the future with this. Ideally, it shouldn't be here by now. Hopefully, it's just a fluke and it'll only happen this 1 year, and we'll get back to our normal seasonality coming in coming years. It's just so hard to say right now. It's just been such a mixed up year and a half, where everything you think is going to happen does not happen, and just vice versa.
What do you foresee? We have summer activities, and the age group that you described as young children are very active in the summer. There are summer camps, there's just being outside, going to the pool. So what does this mean for those activities? And then what does it mean for going back to school in the fall?
Well, again, it's with the summer camps, especially the ones where they have overnights, they aren't usually the young children. They are the older children, adolescents, teenagers. But there's already been a very large camp outbreak in Colorado that's happened. That could be COVID. I'm not quite sure what it was, but they had over 80 children who were positive and had signs and symptoms of respiratory viruses. But again, going back to school, we're going to be just preaching the same message. If you're sick, don't go to school. If you do go to school, I mean, we're not saying you have to wear a mask, but a mask is certainly an option that could be used again. So, but the big thing is using good hygiene, really good hygiene. Respect others who are around you. Try to limit the spread as much as you possibly can. But another issue is daycare. There's been a lot of daycare outbreaks, and unfortunately, we haven't had one in Wisconsin as yet, but we're continuing to monitoring that situation. But I know for a fact several other states have had very large outbreaks, 15 to 20, maybe even 30 children who have come down with these different types of viruses. Parents cannot send their children to daycares. You know, you don't want them to give them a little bit of a fever reducer just so they can be eligible to get into the daycare and then have to pick them up 4 hours later. We really need to have good compliance from all the parents and just practice our good hygiene and keep pushing it.
You've mentioned a few times we don't want to get complacent, and is that referring to the mask wearing, the hand washing? And do you foresee future health guidance of wearing masks in public spaces and congregate settings and social distancing? Do you see that as long-term health guidance that the department might consider to try and prevent these outbreaks?
I think masks are going to be here to stay to some extent. I don't know that we'll ever get back to another mandatory masking, but I think people should be aware that the masking did work. It did prevent illnesses from COVID, and it did prevent illnesses from influenza. It's something that can be used in the future. I hope it does not come down to a point of a mandatory masking as it had before. But again, it's with the masking, sometimes it's being done too quickly. So I think some states actually stopped their mandates a little bit too early, in my opinion. But it's a proven method that it has worked, and it's something that's going to be in our arsenal of coming years as well.
We saw with COVID, and we've seen with viruses before, that people who are not as affected still can transmit it to more vulnerable populations. Is that what's happening right now? And where exactly should people be most careful?
Well, yeah, there's always that possibility of people being able to spread it at least the day before. I know with COVID, it could be several days before, but it really hasn't been studied as much with the parainfluenza and RSV. But with all of the similar types of viruses like influenza, at least 24 hours before the actual symptoms start, you can spread it to others. You want to be extremely careful of where, spreading it to vulnerable populations. Again, if people have any kind of sign and symptoms, forego that visit to the long-term care facilities, even though they're starting to open up admissions now and also visitations. Don't go in if you don't have to. Because again, if these viruses got spread very quickly within the facility, a congregate facility, they'll spread very quickly. And we have had some major outbreaks in the past in Wisconsin that unfortunately have resulted in fatalities as well. So you want to limit your time with all vulnerable populations. And again, that'd be younger children, older populations, anyone who may have some kind of underlying disease. And you may not know that answer, but that's why you just need to keep practicing the good hygiene and be respectful to others and try not to spread this particular viruses.
For those who are eligible to get a vaccine, will getting a vaccine help decipher between what kind of virus someone might be contracting?
It could. I mean, we certainly encourage influenza vaccine and COVID vaccine. But as far as the other viruses, the symptoms or signs and symptoms are pretty much the same. So again, the only way you're really going to know is to test. But the benefit of being vaccinated against COVID and against influenza is that you don't have any of these you won't have any co-viruses. You won't have RSV and COVID together, which again could be deadly for anyone, any population to have multiple different viruses at a time. So again, we encourage vaccine as quickly as possible. If you haven't got the COVID vaccine, please consider it for yourself and for the people who are around you.
All right, we need to leave it there. Tom Hopt from the Wisconsin Department of Health Services, thank you very much for joining us today.
Thank you very much.
For more from Here and Now in PBS Wisconsin, you can visit pbswisconsin.org, and thank you so much for joining us on Noon Wednesday.